Welcome to All In, a straight-shooting, science-based podcast about periods, fertility, and nurturing health outside of unrealistic beauty expectations. We will mostly, but not exclusively, focus on hypothalamic amenorrhea, HA, a component of the female athlete triad, and relative energy deficiency in sport.
I'm Dr. Nicola Rinaldi, scientist and lead author of the book No Period, Now What? I specialize in helping people understand how their eating, exercise, and lifestyle habits are keeping them from hormonal health and their best life. My work focuses on regaining periods, improving fertility, and breaking free of the rules of underlying diet culture.
My name is Florence Gillet. I'm a certified eating psychology coach and the founder of BeyondBodyImage.com. I specialize in mental recovery, helping people let go of toxic health beliefs to finally feel at ease in their bodies at any size.
Every 2 weeks, the All In podcast brings you real recovery stories, expert insights, and new scientific research on HA, hormonal health, and fertility, with an unmissable touch of body respect and women's empowerment.
Just a reminder that this podcast represents the opinions of the hosts and their guests. The content here should not be taken as medical advice. It is for informational purposes only. And because each person is so unique, please consult your healthcare professional for any medical questions. Music by the Andy Shulman Band, available on Spotify. And hello, Nicola. How are you?
Doing really well, and I am so super excited about our guest today, Dr. Jennifer Gaudiani, who runs her own clinic out in Colorado. And Florence, why don't you tell us? Why don't you read us a little bit of Dr. G's bio, and then we can get started on a conversation.
Yes, I am also super excited to have her on board. So Jennifer Gaudiani is the founder and medical director of the Gaudiani Clinic, board certified in internal medicine. She completed her undergraduate degree at Harvard Medical School at Boston University School of Medicine and her internal medicine residency and chief residency at Yale. Dr.
Wow.
Gaudiani has been a leader in the eating disorders field since 2008 and served as the medical director at the Acute Center for Eating Disorders prior to founding the Gaudiani Clinic, which is a Denver-based outpatient medical clinic dedicated to people with eating disorders and disordered eating. The Gaudiani Clinic is a health at every size informed provider, and embraces treating people of all shapes and sizes, which is really also why we wanted her on the show, because we are very into health at every size in our respective practices. So welcome, Dr. Gaudiani. Thank you so much for being here.
It is a pleasure and a complete delight. We were fangirling before this. I specifically was expressing to the two of you how grateful I am for your work, for your incredible ongoing presence, guidance, mentorship, and how it's inspired many of my patients in their recovery journeys. So I couldn't be more thrilled to be here.
Thank you so much. It's definitely fangirling all over, because I think that the respect and admiration are mutual.
Absolutely. And, we will also talk about your book, which is called Sick Enough, A Guide to the Medical Complications of Eating Disorders, which was really such an eye-opener for both of us, I think, Nicola and myself. So first, I would like to ask you, Dr. Gaudiani, if you can tell us a little bit about yourself that I haven't already said, and why you decided to work with people with eating disorders.
I would be delighted to. My story and my inspiration comes, as many do, from a lot of different sources. I am the oldest of three girls, and when I was in medical school, my sister developed an eating disorder and has been very brave and also generous in sharing her story and being willing for me to share pieces of her story. I also had a close family friend with type 1 diabetes who developed what is casually called diabulimia, with the restriction of insulin in the service of an eating disorder. And, watching my sister struggle with and ultimately triumph into recovery made her a stronger woman, a more compassionate woman. She is an extraordinary human as it is, but I think watching her really helped me understand who who and why, who gets disorders like this, and what keeps them in it. It really opened my heart. And with our dear family friend, I watched her get crummy medical care. I
Mm-hmm.
watched her be treated with assumptiveness and condescension in a system that wasn't able to hear her whole story in order
Yeah.
to show up for her as a complete person. There was this focus on, let's get the glucoses under control, and a complete ignorance of what might be causing this incredibly brilliant person to not be doing that. So though their stories deeply inspired me in my medical training and in the kind of doctor I wanted to become. And then when my husband and I got to Denver, gosh, at this point, I guess it's about 14 years ago, I just by great fortune ended up with the opportunity to help grow and run a medical program which is still considered the top in the country to do
Mm-hmm.
medical stabilization for critically ill adults with anorexia nervosa. And I mean, that was it. As soon as I started seeing these patients, I was like, these are my people. I love them. I love that I can practice general medicine within a very specific patient population. And I was absolutely entranced by the opportunity to combine the narrative of their life story and who they are as a whole person with good science and with an
Mhm.
overarching feminist and social justice oriented perspective. And then in 2016, I made a really hard decision and said, gosh, I want to know patients for longer than a 2-week medical hospitalization. I want to witness their graduations, their marriages, sometimes their births of children. I
Mm-hmm.
want to be there for them in the long term. And I think it was really at that point that my social justice interest and awareness started to develop. It was nascent and had potential, but I needed to do a lot of work. So that was important, and I adore my clinic. I love seeing patients from all over the country, and sometimes folks will actually, at least pre-COVID, fly in from around the world, which is really
Mhm.
nifty for consultations. And on a personal note, my daughters are 15 and 12 now, and parenting them has been a real joy and an act of great nerdiness on the part of how I think about bodies and
Mm-hmm.
people of all genders and their bodies, but how do I think about raising young women in my own family who are genetically programmed with some of the traits that could lead into an eating disorder? How do I show up best for them as their mom? And I guess on a final personal note, I'm an avid reader, but despite having been an English major, I do not read literature as much as I read YA fantasy books. The more, magic and dragons and vampires, the better.
Uh-huh.
That's cool.
I'd love for you to tell us a little bit more about your book as well and kind of where that came from and why you felt compelled to write it. Because I think that a lot of that reasoning probably plays into what we see in women with hypothalamic amenorrhea in terms of not feeling like there's anything kind of wrong enough to deserve treatment. So if you could tell us a little bit about that, that would be fabulous.
I would love to. Thank you. So I had this very dangerous combination of things happen to me at the same time back in, gosh, it must have been 2017, where I went and spoke at the Female Athlete Conference in Boston and
Mhm.
felt very fired up by the incredible people that
It was
I
an
met
amazing
there
conference. Yep.
and by the topics and just the empowerment. And at the same time, Wonder Woman came out. And I
Mhm.
watched it twice in the theater in the matter of a week, and I was completely obsessed. So I was very fired up with girl power. And I thought, look, I've just started this clinic. I won't take a salary for years. I'm deeply in debt as I started it up. I'm learning how to be a businesswoman and an outpatient provider. I'm learning about social justice and about weight inclusivity. I'm kind of up to my ears, but there's never going to be a good time to write a book, as
Mhm.
you know. But I feel like one of the reasons I started this clinic was not just to do direct one-to-one patient care, but also to uplift the quality of medical care for people of all body shapes and sizes with disordered eating and eating disorders around the country and around the world.
Mm-hmm.
So I have things to say, and I want to share my medical expertise and my narrative style with more folks than I will ever have an opportunity to see one-on-one. So I drew from incredibly generous friends' experience and recommendations, and I sat and had a kind of Jerry Maguire-like writing session where I put together a book proposal. And just as I was finishing that and thinking, okay, gosh, I'm a little intimidated right now, what happens next? I got outreach from the mental health editor at Routledge saying, oh, I see you're going to be doing this talk soon. Have you ever considered writing a book? And I was like, here's my proposal. So the idea behind the book was I want to present a diverse set of patient cases, all of which are hybrids, of course, no patient's information was compromised in it, that really illustrate the broad variety of things that happen to people's bodies when they don't nourish enough and they push their bodies too much without adequate fueling.
Yeah.
I wanted to highlight, just even from the very cover of the book, where I chose a bunch of highly diverse face portraits, that somebody picking up the book could look at the cover and think, oh, I kind of see myself in this. That's interesting. I didn't know I might be affected by this. And I hoped in the pages that they would see glimpses of themselves in the vignettes and that they would find comfort and clarity from the metaphors that I use with patients as I try to talk around the resistance of the eating disorder and tell stories that can help find the heart where the brain might be resistant. And in doing so, my entire hope was not only to improve clinicians' ability to meet patients where they were and perhaps to educate doctors as well, but to empower families and individuals to speak up for their healthcare and to get validated in the myriad things that begin to go wrong, whether they're measurable or not, when you don't take care of your body generously and abundantly. And I hoped that people would come away from reading this and say, oh gosh, my labs are normal, my weight, nobody notices, but I'm realizing now that these behaviors are contrary to my values. And I see now that things are happening in my body that make it worthy for me to seek out help.
Makes a lot of sense. And I think the metaphors for me were really, really very powerful because they, as you say, they really allow to reach the person, even though their eating disorder might be there as a filter, right? So when you speak to them in medical terms, it might not come true. But if you speak to them with those stories, then it makes a lot of sense. So I'm really amazed at how many you had in the book. One of the ways that I would say I really learned a lot by reading what you said about medical complications for eating disorders were, for example, the concept of the cave person brain. And this link between really starvation and the brain being constantly on high alert, anxious all the time. The whole metaphor with bears hibernating. I think it would be really helpful if you could maybe explain a little bit of the cave person brain for listeners, because I think a lot of people do not know that there is really a link between physical starvation and what happens to your brain when you don't feed yourself properly.
I would love to. Thank you. This is a metaphor that I almost always go over with my patients and their family towards the beginning of our care together because it's so universal. And what I like about it is that it applies not just to people with eating disorders, but also to folks who are athletes with relative energy deficiency of sport, who have no desire or focus to change their body shape, but maybe accidentally undernourishing.
Mm-hmm.
It also applies to people who are caught up in diet culture, who may not have eating
Totally.
disorders, but who find themselves compelled by a sizeist medical system and by a sizeist society to continue to put their body through cycles of deprivation. So I really love how broadly applicable this metaphor is. And the idea is this, that we evolved as a species to resist and survive starvation.
Yeah.
Humans evolved vastly more during a time of want than of plenty.
Mm-hmm.
And as a result, our brains, and this is as neurobiological as I get, because I actually almost didn't pass neurobiology in medical school. But the part of our brain that runs us as a mammal and that we don't have conscious control over, that I call the cave person brain, is constantly scanning us for adequacy of nutrient intake. Because that's why the three of us and all of our listeners are alive today, because our ancestors exquisitely evolved to watch for this and respond to it. So within a few days, much less the weeks and months that folks we know go through of malnutrition, within a few days of inadequate intake, regardless of your body size, your cave person brain says, oh, I'm here for you. I don't know what's happening in your environment, but I can tell you're not getting enough. I will save you.
Mm-hmm.
And it gives messages to every organ system in your body to change and shore up your body to protect you from harm from starvation. The first thing it wants to do is to lower your metabolism, which roughly means, in a layperson sense, just the amount of energy you need to sustain your weight. It says, well, we got to slow this down because we don't know when we'll get food.
Yep.
And it does that by making physiologic changes similar to that which a bear does during hibernation. It increases our vagal tone, slows our heart rate, slows our digestion, reduces our overall energy to do things. It cools down our extremities so that we're not wasting heat through our hands and feet. It makes us feel chilly, so we seek warm sweaters and mugs of tea because it doesn't want to burn those calories to keep our body temperature up. And it begins to change the way our brain thinks about food. When a mammal is starved, and I don't mean underweight, I mean when it hasn't eaten enough, it's not playful, it's not creative, it doesn't do things for the fun of it. It becomes very focused, quiet, serious, and a little paranoid, looking around the world like, hey, I'm clearly kind of fragile right now. I might not survive a dangerous encounter, so I'd better look at the world as being dangerous because I got to protect myself here. And I hope folks listening will think, oh, yeah, that's kind of how I feel when I'm not eating enough. I feel a little paranoid. I feel kind of neurotic. I'm really focused. I'm very rule bound. I don't laugh as much. Oh, I'm just a mammal. Okay. All right, that makes sense. And in all of this, your brain starts to get a little weird about food because we were evolved to do this, not because we lack willpower. That is, when we have the opportunity, having been deprived of food for whatever reason, this could be food inadequacy, it could be a diet, a fast, an eating disorder. If we have access to a big plate of sweets all of a sudden, and we've been restricting, our brain is designed to make us not just have one nice cookie and be satisfied, but to eat the whole thing. That is how we survived coming out of the wilderness. We have to have that drive to get safe. And so people mistakenly think, oh my gosh, I can't eat sugar. I'm a chocoholic.
Mm-hmm.
Nonsense. That doesn't exist. It's that when you deprive yourself of a class of nutrients or of adequate nutrients, and you finally get access to it, your cave person brain will override whatever your cognitive brain has thought is its rule, and it will get it.
Mm-hmm.
Yeah.
So the final piece to this, of course, there's lots to talk about, but I want to make sure that I don't speak too long here, is that we are, again, biologically designed, when deprived of food, to nudge our set point weight range up a little.
Mhm.
Because our bodies understand that if we've gone through starvation now, we might again. We can't trust the environment. So let's be sure that we add a little weight to ourselves so that we're more likely to survive the next famine. And in this way, we understand that dieting is bullshit
Mm-hmm.
and that it is harmful and useless, and that in the long term, the only way that one can honor this extraordinary body we get on our turn around the planet is to nourish it with abundance, adequacy, satisfaction, and consistency throughout our lives.
Beautiful.
Wow.
Yeah.
And I want to just underline what you said twice in this, is that weight has nothing to do with this. Because this is something we have to repeat every time about HA as well, is that you can lose your period at whatever weight. And obviously it's all part of the same thing. So you can get into this whole mammal response at whatever weight, as long as you're depriving yourself and you get into this energy deficit, which is effectively causing HA as well.
That's absolutely right. What I love to think about when I'm talking about cave person brain, and it's so funny that I didn't happen to include it in my list while talking with you two experts on this for this podcast, is that one of the ways that the cave person brain protects us from malnutrition is to say, this is no time to waste calories on sex drive, having sex, wasting menstrual blood for people who menstruate, or getting pregnant and sustaining a pregnancy. And so, for people of all genders, their brain just kindly shuts down their sex hormone production.
Yeah.
Testosterone goes away and estrogen goes away. For some, not for all. There's always a bell curve of who actually has what symptom, which is just a matter of genetics. But you're exactly right that we are living in an epidemic of false and harmful medical information, wrongly connecting a body weight or appearance with health. And we must disconnect those and understand that these cave person concepts, these notions of nourishment and movement, apply to every single human across the weight spectrum.
Yeah, absolutely. So there's so many things that you've said that I want to dig into further. So one of the things is so many people think of having a slow heart rate as being a sign of fitness and an athlete. And, my heart rate is so low, I'm in such good shape. And this was a concept that you talked about when we first met at the Female Athlete Conference back that you were talking about. And I know you also talk about it in your book. So could you tell us a little bit more about that? Because I think that's one place that it's really hard for people to see, the difference between being athletic and fit and having a low heart rate for that reason versus actually it being a marker of illness and starvation.
And
Absolutely.
for doctors too, by the way. Sorry.
Yes. Well, that was another thing I wanted to get into is how do we educate the medical community more about this? Because there's just so much misinformation, misdiagnosis, misunderstanding of all of these processes, misunderstanding of, a menstrual cycle. And how do we kind of get the word out more about some of these issues? So 2 totally separate questions, but.
Yeah, no, I think that's so important. The classic scenario is that an individual, in this case, I'll choose female pronouns, goes to her doctor often against her desires because her family, her partner, her coach, her therapist are really, really worried about how she's undernourishing and overmoving in any body size. And eating disorders, and to a certain extent, diet culture, will find every reason to justify the allowance of the ongoing behavior. There, a hallmark of eating disorders is denial of severity. It's a way that the eating disorder sustains itself and protects itself. So usually the patient herself is like, oh my goodness, you guys, I am fine. I'm fine. Look at all the things I'm doing in my life.
Mm-hmm.
I've seen other people online. They're far thinner than me. I had labs drawn a few months ago. They were fine. I don't know why everybody is being so fussy about this. This is ridiculous. Fine, I'll go to the doctor. And she'll go to the doctor and she'll have a pulse of 49. And she'll say, Doc, I eat super healthy and I work out a lot. And the doctor will look at her and say, you're right. You are eating super healthy and working out a lot is awesome. And here, look at your pulse. You have an athlete's pulse. You're fine.
Mm-hmm.
And this patient leaves the office deeply harmed. The doctor didn't mean to be mean, but it's not about intention. It's about impact.
Mm-hmm.
And the rest of the incredibly worried family members express a just collective groan of misery that now they've lost another 6 months of opportunity to make inroads on behavioral change. So here's the reality. A beautifully fit athlete who is working out, nourishing beautifully, and resting their body appropriately may have a modestly slow heart rate, sort of in the 60 range at rest, sometimes in the 50s as well. And when they're seated, their pulse is, say, 58. And when they walk over to the kitchen to get a cup of water, their pulse is about 62. And when they pop upstairs to grab a book, their pulse is about 65. It's always slow because the heart muscle is strong, vigorous, and well-nourished.
Mm-hmm.
But those little activities of daily living don't change it too much. And when they work out, of course, it goes high as their body does work. Somebody who is malnourished, by contrast, even if they are working out a lot, will have a slow heart rate at rest because of high vagal tone, because of hibernation, cave person brain, and caloric sparing. Their body doesn't want to waste a calorie on an extra beat of the heart. And those folks may have really substantial bradycardia, officially meaning a heart rate lower than 60. And I don't want to use numbers here because I don't want to have anybody think if my heart rate's not that low, I don't count. But they may have significant bradycardia. And really, studies have shown that even among Olympic athletes, pulses lower than 50 are pretty rare.
Mm-hmm.
Mm-hmm.
But in people who starve themselves, that can happen. And the difference is that if you ask them to walk across the room, to do a modicum of movement for somebody who thinks of themselves as being pretty active, their heart rate will jump up.
Mm-hmm.
There is no evidence-based validated value, but I tend to think if the pulse jumps up 75%, 50 to 75%, just doing minimal movement, we're looking at someone who doesn't have an athlete's heart, but a starved person's heart. And the reason it goes faster with even minimal movement is that it is a starved muscle. It doesn't have the nutrients it needs. The muscle itself may be thinned, even if that's, very, very subtle on an echocardiogram. And so, all the other muscles in the body are also underfueled and undercared for. So someone who sits with a resting pulse that's bradycardic and then has a pulse of 75, 80, 90 with minimal exertion, that's a starved person's heart.
Hmm.
And this doesn't hold true for absolutely everyone. There are conditions like postural orthostatic tachycardia syndrome that can interfere, that are dysautonomias. But broadly speaking, we have to query our association of a slow heart rate with automatically meaning an athletic fit heart.
Yeah, thank you so much. That's so super helpful because I think that, like I said, that's one thing that so many people point to about why they're not, why they have no problem. They're just, I'm an athlete. I have an athletic heart. Everything's fine. And I think really having that distinction, how people can tell sort of the difference, I think is really, really helpful for changing their mindset about themselves and what their needs are, and maybe pushing them a little bit to start to nourish their body better and, improve all of the different things that you've talked about.
And what's exciting is that you can use that objective medical evidence to ask bigger questions.
Hmm.
I really love how, educators like my beloved Beth Hartman McGilly and others have taught me that someone who is truly an athlete who does not have an eating disorder, when they learn about this, they'll say, "Oh my gosh, I'll do anything I need to heal my body and honor it and continue to do my best work as an athlete. You need me to rest more and nourish more? Great, sure, no problem."
Hmm.
Someone, however, who has an underlying core of disordered eating or eating disorder will respond to data like that with fear and resistance. Oh no, I couldn't possibly change my training regimen. Oh no, I couldn't possibly eat more. I couldn't possibly add more carbs back in. I couldn't take more rest. That's when you have to say, oh, okay, there's actually something more going on here. This is not accidental undernourishment. There is something here that is sustaining illness that needs to be addressed in a multidisciplinary fashion.
Hmm.
That's a great segue, actually, because one of the questions we had, and I think the example you used also about someone who comes to the doctor, with this typical profile, and the doctor says, like, yes, keep it up. That's fantastic. Because unfortunately, again, like there's a lot of confusion as well about like what looks like health and what is really healthy. I think for a lot of the menstruators that are, in our groups because they have lost their periods, for a lot of them, it is really incredibly difficult to suddenly turn around and say, I'm going to have to eat all the foods that I've deemed unhealthy for so long. So we were curious to hear from you, like, what are some of the strategies that you can use to kind of help them realize that right now what is really healthy for them is high calorie foods and, plenty of fats, and making sure that they really get that nourishment, and that there really is no foods that should be considered unhealthy at that stage. Because a lot of the times, obviously, what our society considers to be super healthy is actually avoiding a lot of the high calories and high nutrients foods. So, what is kind of a way that you could maybe give some advice to some of the people listening to us that feel terrified to just change the way that they eat?
That's such a beautiful and important question. I think the roots in my answer have to start with an acknowledgement that yes, every individual can make choices for themselves that honor their health and wellness. But we cannot view this situation as being primarily one where I point to the patient and say, you have a body image issue, you have a problem with food, you have distortions. This is an individualistic solution. Because the reality is, people wouldn't think this way unless our society was so
Yes.
sick,
Hmm.
and unless the medical system brought that illness in their own biases into the medical office. So I always want to start from a systems perspective and say, the reason why people have been brainwashed into thinking that carbs are evil, or sugar is evil, or there are foods that are morally wrong to eat, is because of thin privilege and the deeply mistaken, misguided, and toxic role of which bodies are acceptable, permissible, appealing, and which ones get basic human rights in our society, much less pleasant, positive. And I speak this recognizing my own thin privilege and numerous other points of privilege, in understanding that everyone gets messages constantly, everywhere we look, that it's a very narrow type of body that includes being more white, cis, hetero, young, able, and thin, that is the desired outcome. And people see all the time that that is who gets the easier walk in life. Then you have a medical system that I trained in myself and that I have done harm in myself, that again falsely equates size with health automatically. And so it's understandable why people would show up with terror, not because they're a terror-prone person, although certainly, you know, many folks are a little on the more anxious and intense side who end up getting eating disorders, but because society strikes terror into them about diverse bodies, and so do doctors. So my first thing to say is, be incredibly kind and compassionate with yourself about the roots of your terror when you think about change. This is not a you problem, although only you hold the solution. It is a problem rooted in our families of origin, in our society at large, and in the medical system, and in the diet culture that earns billions of dollars off of selling people the false promise of body privilege if they'll just buy this plan. So I think that that's a first answer that we have to speak. The second one is to say that it is people like you, it is podcasts like this, it is books like yours that reintroduce people, or maybe introduce them to the first time, for the idea that we don't have to fear our bodies. Our bodies aren't things to be wrangled and controlled, distrusted, and overseen. We can trust our bodies. And that doesn't mean that trusting our bodies will necessarily lead us to every point of privilege that can be had. We shouldn't be changing our bodies to meet constructs of privilege. We should be disrupting the system that identifies that only certain bodies have privilege. And so, you know, I think for those out there who are disabled, for those out there who are built big, for those out there who have been harmed by diet culture and weight cycling for so long, that their bodies now will always be in a larger size than perhaps genetically would have taken place had they not been harmed that way. For those who have to be on medicines that alter their bodies, for those with a trauma history, what we have to say is there's no double standard in this message, unlike what's been in the eating disorder community for many years. Your message, my message is, every body deserves abundant, satisfying, balanced foods according to taste and satisfaction, but many people need to fully relearn what it means to be hungry and be satisfied due to lifelong eating disorders or diets, but that can happen, and that every body deserves rest and psychological comfort. With regards to movement, I hold space for the fact that some do not care in the least bit about moving their bodies at all, and that is their right. I don't have to impose a view on them. And for some, the elite athletes, they will be doing workouts that I could not possibly imagine, and that I honor that that's what their body does. There is space for every point in between, but there is no such thing as a morally bad food. Now, when I speak about HAES, when I speak about food in this way, inevitably some troll comes along and goes, okay, Dr. G, so you're saying that everyone should just eat chips all day long and it doesn't matter and that doesn't impact health? Absolutely not.
Right.
But I'm very interested in the idea of healthism, which is my learning limit right now. And I'm really trying to push into that, which, as I understand it, means that doctors often foist upon patients a one-size-fits-all version of health, measurable and unmeasurable, that may not be congruent with the patient's own desires for themselves. And that can come down to, exactly when you decide to start getting screened for certain cancers and take on certain heightened risks of false negatives or false positives, et cetera. When it comes to this particular topic, it means that I start by asking my patients, what are your values and goals? And if they say, gosh, Dr. G, I'd really like to be able to walk without shortness of breath and to be more active with my kids, then I will help encourage them to move their bodies more and more with rest and listening to body signals so that they accomplish that. But if somebody does not, or somebody says, I want to have a really great ski season, great, they're going to have a different yet set of recommendations around how do we get strong, how do we focus on endurance. And if somebody doesn't want that, I am not going to impose upon them some silly prescription for, you should walk 3 times a week for 30 minutes a day. No, it has to be individualized based on what the individual's health goals are.
Mm-hmm. Yeah, for sure. One of the comments I often make with regards to what you said about, eating chips all day, every day is going to be unhealthy. I'm like, eating kale all day, every day is also going to make you unhealthy. So there has
Amen,
to be
sister.
balance and, a variety of foods. And in amongst that, you can include all different types of foods. You can include sugar, you can include chips, you can include broccoli, you can include kale. All of those have value to them. It's not, our bodies are not designed to eat only one type of food. And I think that that's sort of this message that we're getting, that, there's only certain foods that are good foods and everything else is going to wreak havoc in your body. I'm like, that's not how biology works, actually. So, yeah.
That is 100% true. And it strikes me that one must call a spade a spade. If someone is eating restrictively in the name of health, and then they read your book or they listen to your podcast and they say, I haven't had my period for a year. And maybe furthermore, I just got a bone density result that shows that my bones are suboptimal for my age and activity level. You can no longer retreat under the banner of health for how you're eating, because you have proof that this is not healthy for you.
Yes.
So call a spade a spade. I am now following these food rules because I believe them for arbitrary reasons to be morally superior. And I find myself caught in a fear trap. Okay, now we can take that to a therapist and work on it. But to say by saying, no, but these foods are healthy, baloney. I just told you they're not. I just told you that the way you're eating is not healthy for your body. In fact, it's causing harm. So let's call a spade a spade.
Yeah.
And I like that you kind of remind patients also of their own values. I find that to be very powerful because a lot of them will not consider themselves being fat phobic. And then when you kind of start saying, well, look at the whole system, it's no wonder that you are scared of being in the larger body because this is actually what is put into our heads, like by force. Then they realize they're like, but no, I believe that everybody's a good body, but mine should be XYZ, right? Not for me. Or it's okay for you, but not for me. So I think really digging into what are really the values that you'd like to live by allows for people also to realize that maybe there is really a dichotomy in what they're thinking and doing, and also that maybe they don't actually access the joy or the fun or the success that they had in mind when they started maybe dieting or restricting.
I think that's so smart. Yeah.
One problem that we see a lot in people that sort of do end up going to eating disorder treatment is that the treatment paradigm in so many places is still very weight focused, and the idea that, oh, get to this weight and then you will be recovered and healthy. And it's, so many people come to us after that and they're like, well, I still don't have my period. So I'd love to hear a little bit more about how you kind of approach the treatment paradigm in your clinic, and if you have recommendations for people who are being treated in a place like that where it is sort of still very weight focused, fat phobic. How can they better advocate for themselves and maybe help change minds a little bit? Because I think it seems like you have this amazing treatment paradigm and center, and the way that you think about it is just beautiful and life affirming. And I think really can help people to truly recover to a place where they are just able to live their lives afterwards. And unfortunately, that doesn't seem to be the norm yet. And so how can you, any suggestions you have for people and thoughts on that topic would be lovely.
That's such a good one. I think the eating disorder field as a whole is growing and improving. I myself have come so far, and I still have so far to go, no doubt about it. And I'm very, very grateful for generous teachers and for patients who correct and teach me.
Mm-hmm.
I do want to validate that historically, all levels of care in eating disorder programming have been sizist, as is the insurance system that pays for care.
Mm-hmm.
And of course, access to care is a massive problem in this country. But if we even just look at the DSM-5, the fact that so-called atypical anorexia nervosa is listed under other specified feeding and eating disorders, when so-called atypical anorexia, which I hate the title of because it's anorexia nervosa in someone who's not visibly emaciated. That's all atypical is. It's way more prevalent than anorexia nervosa, way more prevalent. But the fact that it's relegated to OSFED category means that insurance companies can choose not to cover care for it. They can say, oh no, your benefit only covers anorexia nervosa and bulimia nervosa. It doesn't cover OSFED. So automatically there's sizeism with real financial and access to care implications just in the way we use our words.
Mm-hmm.
Then we get an insurance system that is completely weight focused and number focused, such that people who have eating disorders who need containment of higher levels of care can't access it. The insurance company says, oh, your weight's not low enough, or you haven't lost enough weight. Your BMI invalidates it. Clearly, no one with your BMI could need treatment. And historically, that has also impacted those with bulimia nervosa. But I think what I understand more and more is how many people lose out on resources and on absolutely necessary medical, nutritional, and psychological care because of sizeism in the system. So that's just like getting in the door. Being in programs themselves, all programs, and I myself need to continue to get more and more sophisticated in our internalized biases and in not joining with the patient's biases and fears. I'll admit that in the past, especially when I was in my hospital program, when someone with anorexia would say, Dr. G, I'm so afraid of getting fat, my soothing reply, which was inappropriate and harmful, was, don't worry, you're not going to get fat. Oh, I look back on that with compassion for myself that I hadn't learned it, and with determination not to replicate it. That's the same thing that happens, by the way, when our children ask us, Mom, are you fat? Mom, am I fat? to say to your child, no, honey, you're not fat, you're beautiful. Oops, look what we've done there.
Yeah.
And, but within treatment, I would say that treatment programs, for the most part, are trying to do wonderful work. They're trying to help people who need it in the best way they know how. And they're continuing to grow and learn. But a lot of what they do is driven by money and what will be paid for. And so we get caught in this infinite wheel of, in some cases, inadequate weight restoration. In some cases, lack of respect of patient autonomy, which can involve overweight restoration in some that makes them distrust the system. In the final analysis, somebody's healthy weight range, and increasingly I put a minimum number and don't put a high number, because who the hell am I to say that somebody should be between these two numbers? No, what we learn is in getting to know a patient, I'll often set, hey, what we've seen in your body is that when you go below this minimum weight, your body doesn't function well. So this is your minimum weight, and anything above that is likely to be reasonable. That has to be super individualized based on growth curves, familial body type, historical function in season and out of season for serious athletes. And in the final analysis, periods come back and hypothalamic amenorrhea resolves on a bell curve. I sit on the editorial board for the International Journal of Eating Disorders. And I personally, in my experience, have seen patients whose periods come back when they are not well, when their body weight is not adequate, when they're not fueling enough. And that's just them being on one side of the bell curve. I've also seen patients who have been beautifully caring for themselves for a year, fueling, resting, thinking about their psychological health, and their periods aren't back yet. And what I tend to say is we need to keep having a really individualized perspective for each patient that honors their unique body.
Yeah, very much so.
That's awesome. I think it's something I also feel like you. I mean, I'm a volunteer for the Middle East Eating Disorder Association here. And I really see, I've been a volunteer for 2 years only, but even in 2 years, like I really see that it is evolving. And that the discourse is slowly changing. A lot of practitioners ask themselves more questions beyond just the size and the weight, but also, about different biases that could be based on gender, identity, or, race, or being in an able body. I mean, all of these different things. So I really have hope. I think both of us, Nicola and I, we wouldn't be doing this if we didn't have hope, I guess. But it was beautiful to hear you answer that question. I think we have 2 more questions for you. Number one is if you have one kind of key message that you'd like to share with all of our HA listeners.
Yeah, I would love to share with them the message that I wanted to share from Sick Enough, which is trust your inner wisdom and surround yourself with trusted experts if you possibly can to advocate for what's right for your unique body, recognizing the harm that the medical system can bring, and recognizing that every person's journey will be unique, but that each person deserves to resist the shackles of sizeism and the call of thin privilege, and must ultimately be allowed to live their life according to what matters most to them.
Yeah, thank you. I think that's a great message. Yeah. So our last question for our podcast guests is, we have this concept of all in the No Period Now What community in terms of really nourishing your body, eating enough, eating all different kinds of foods, cutting out high intensity exercise as necessary. And it's really so much more than that as well. It's about being more present in your life, enjoying the people that you're around, as you were just talking about, throwing away the shackles of dieting and, the everything that society tells us we have to do. So we'd love to ask you about another way in which you are all in your life, your work, all of that.
Absolutely. I love this question. And the way that I'm currently most all in is on fiercely defending my engagement in self-care unconditionally.
Mm-hmm.
Not once all the work is done, not once my clinic notes are done, not once the groceries have been, put away in color coordinated order. Nope. That I will affirm the necessity of receiving and giving myself self-care in ways that delight and refresh me, even when there's still stuff left to do on my to-do list, because there always is.
There
And I
always
do
is.
it for me because I have to in order to show up. But I also do it so that I can walk the talk for my patients
Mm-hmm.
and for my daughters, because I want my girls to have memories of mom chilling on the couch with a nice big bowl of snacks, reading a dragon book.
Mm-hmm.
Even though the house is messy and there's things to do, because in our house, we honor the right to rest and recharge.
Yeah. Oh, that's so important. And it's so hard to do. I mean, that's definitely a big challenge that I have, and I think Florence, you as well. And yeah.
Don't know what you mean. I rest all the time. No, I think it's definitely, I mean, all of us, at least in our no period now what community, most of us are A-type. And yes, we have this, obviously we also have this, I don't know if you read the book Burnout by Emilia and Emily Nagoski. It's a really great book on stress for women. And they have this concept saying women are brought up to be human givers, not human beings.
Mm-hmm.
And that really resonated with me, because it's kind of the whole way we're socialized is really about giving, right? And we're always last to be the ones that can say, now I can rest because I've taken care of the kids and the husband and the house. And
I need that book.
I will read it now too. Thank you.
It is really good. And by the way, Brene Brown is a great, I can link in the podcast to the Brene Brown interview also. It was really good. That's what made me want to buy it. But anyway, I think it's a great reminder. So thank you so much for reminding us first.
Yes.
And I'm sure everybody else in the HE community that supports us and listens to this podcast will be really thrilled to know that even you can make this commitment, with all the different hats and responsibilities that you carry. So I think all of us really have to do that. And I love what you said about being a model, because I agree. Most of us have grown up with mothers that were overstretched. And it was not a great model, to be honest. All respect to our mothers who tried their best and did what they thought was the right thing to do, but definitely not the thing I want to pass on to my kids, for sure.
Yeah. I think we're just about out of time, but if you could briefly tell us how people can find you and your work, that would be lovely.
Thank you. I would love to. We have a magnificent second doctor in our practice who follows all of these same precepts that I do, and we eagerly welcome patients. We can be found at www.gaudianiclinic.com, which is GAUDIANI clinic.com. And Sick Enough can be found on Amazon, as well as the Sick Enough website, which is just www.sickenough.com.
Fabulous. Thank you so much for coming on and chatting with us today. This has been an amazing conversation, and I think going to be so useful for people in our community and other people who come and find the podcast. So thank you.
Thank you both so much. It was truly an honor.
All right. I hope you enjoyed this episode. Maybe take a few minutes to reflect on it and how you have been all in this past week. It always strikes me how different each person's all-in journey is. As I often say, there are many paths to HA and many paths out of it. Your journey is unique.
That is so true. And if you need more support on your journey, you should definitely start with No Period Now What, which you can get at noperiod.info/book.
And Florence and I both work with people on different aspects of period recovery and so much more. So if you'd like more personal advice and attention, you can go to noperiod.info/appointments to schedule a time to speak with me on fixing the issues underlying your missing periods and figuring out what those issues are.
And I'm at beyondbodyimage.com to work with me on the deeper emotional issues and your body image. I also run a French Instagram account, amenoré_fr. And obviously you can find Nicola at No Period Now What on Instagram. We also have joint clients, so you can access both our domains of expertise at the same time. If you enjoyed this podcast and found it helpful, please drop us a review to help more people find it.
Also, join the No Period Now What recovery support group at noperiod.info/support and let us know how All In is going for you.
All In is not just about period recovery, it's about getting your life back. See you in 2 weeks.
You were lost in Babylon till you got lost again. You were lost in Babylon. Now find yourself and then take all that you've learned about what love and loss, pleasure and pain, and never get lost again.